Here is the cold, hard truth about prevention, according to the Institute of Medicine senior scholar J. Michael McGinnis. People who die early in America have mostly themselves to blame. Dr. McGinnis's analysis reveals that 30% of early deaths are driven by genetics or inherited vulnerabilities. 20% are the result of poor environmental or social policy that creates unhealthy and unsafe conditions. But a whopping 40% of the carnage is self-induced by the unhealthy choices that we make. Front and center is the American diet, which is so bizarre on so many levels. Portion sizes are ridiculous. Processed foods are ubiquitous. Babies getting snack bars on the run rather than healthy foods? Are you kidding me? And normally intelligent people making food choices that promote anorexia on the one hand and obesity on the other. The truth of the matter is that the American food recipe is 1 part lazy, 2 parts rushed, and 3 parts ignorant. And ingesting this recipe, according to a recent article in the Health Affairs Journal, cost each and every American household an average $1,250 in extra costs per year. Most of that cost is tied to the treatment of diseases that are linked to obesity. If you look at all adult Americans, on average, each carries 25 pounds of extra weight. Carrying and supporting that extra luggage means more diabetes, heart disease, arthritis, and cancer. Collectively, and as individuals, we pay the price in dollars and years lost. But we've been saying this for a while, and we've made very little progress. In fact, during the current decade of dietary enlightenment, we've become both more rushed and sedentary, more stressed and self-indulgent, and more inclined to order out and buy junk food on the run for our families. How to break through? The easy answer: take a note from the tobacco playbook and tax poor nutrition. Cigarette tax policy created individual disincentives to individuals hooked to this killer behavior, while generating much-needed revenue that could be targeted to health prevention. The same should be done for dietary products that are making Americans sicker and our nation poorer and weaker. Take soda, for example. Bizarre as it might seem, this very effective carrier of liquid obesity actually costs 1/3 less in real dollars today than it did 3 decades ago. And during this same time period, the price of good food, like fruit and vegetables, has risen by over 1/3. Americans pay attention to price. With all the talk about health reform and how in the world we're going to pay for it, I say this: the quickest way to get Americans' attention when it comes to poor nutrition is to make them pay for it, and pay for it big. For Health Commentary, I'm Mike Magee.